Good afternoon, everyone. My name is Jane Mirimo, a geriatric care student. My presentation title will look at the ethical, illegal, and medical legal aspects. Introduction. The content is organized into three main sections. First section, general ethical and illegal consideration, informed consent, confidentiality, competence, guardianship, advanced directives. Second section, end-of-life issues, do not attempt resuscitation, palliative care, goals of care. Third section, elder abuse and decision-making, elder abuse recognition, ethics in decision-making, and medical legal frameworks. First section, general ethical and illegal consideration. These are informed consent. This is a process where an elderly person voluntarily agrees to a medical treatment, procedure, or participation in research after being fully informed about. It means a patient understands their treatment option and agree to a specific plans. Confidentiality. It's maintaining privacy. This means protecting elderly patients' personal and medical information from unauthorized access, use, or disclosure. As a geriatric care, you have to keep personal information private and not sharing it without permission. Competence. This is essential for informed consent and decision-making in healthcare. For example, if someone is deemed incompetent, a guardian or family members has a right to make decisions on their behalf. Guardianship. A guardianship is where a person is appointed to make decisions for someone who can't make decisions for themselves. This can include decisions about healthcare, finances, and daily life. Advanced directives. These are instructions about your care that you give ahead of time, in case you can't speak for yourself. For example, what treatments you want or you don't want. Who should make decision for you? It helps to ensure your wishes are respected if you are unable to communicate. Second section, end-of-life issues. In this section, there are 3 points. First point, it is do not attempt resuscitation. This is a medical order that instructs healthcare provider not to perform cardiopulmonary resuscitation, in short, CPR. If a patient's heart stops or if they stop breathing, this decision is typically made when CPR would be unlikely to succeed, the patient's quality of life would not benefit from CPR, and the patient or their family has discussed and agreed on this decision with healthcare providers. Second point, it is palliative care. Palliative care is care that focuses on relief suffering, pain and stress for elder adults with serious illnesses, such as dementia, cancer, heart disease, or chronic obstructive pulmonary disease. Key aspects of palliative care: symptoms management, holistic approach, interdisciplinary team, patient-centered care, support for families, and end-of-life care. Settings for palliative care, these are hospitals, nursing homes, homes-based care, and outpatient clinics. Benefit of palliative care is to improve quality of life and support for caregivers. Third point, it is goals of care. These are what matters most to the patient and what we want to achieve in their care. Types of goals of care. Curative goals. This is treating an illness to cure it, not just managing the symptoms. Prolonging goals. This means to extending life even if quality of life is limited. Palliative goals means to relieve suffering and improving qualities of life. Support goals. This focuses on providing emotional, social, and practical support to patients and their families. Third section, elder abuse and decision-making ethics. In this section, there are also 3 points. The first point, it is elder abuse recognition. This involves identifying signs and symptoms of abuse or neglect in older adults. This can include physical abuse. For example, hitting and punching elder patients. Emotional abuse. Use verbs insult and isolation. Financial exploitation. For example, theft and misuse of funds. Neglect, e.g., ignoring needs and withholding care. And sexual abuse. Signs of elder abuse: unexpected injuries, poor hygiene, weight loss or malnutrition, fear or anxiety, changes in behavior or mood. Second point, ethical in decision making. This means making choices that are fair, respectful, and right. For example, respecting people's anatomy, doing good, avoiding harm, being fair and just. Third point, methodological frameworks. There are rules and laws that guide healthcare decisions and action. Frameworks is to ensure healthcare providers follow legal and ethical standards when caring for patients. Methodological frameworks covers areas such as patients' rights, informed consent, confidentiality, medical negligence, and end-of-life care. In summary, the key aspects of geriatric care ethics and laws, including elder patients' rights, end-of-life care, and the illegal frameworks that guide healthcare decision-making. Thank you.